get our first caller on that. Good evening, how are you? Hi, how you guys doing? What's your place? What's your place? Open up the phone lines, give us a call.
Hi there and welcome to the health edition of Talk TV. I'm Ann Romer. Good to have you with us. Have you ever wanted to stop eating and you found that you just couldn't do it? Do you think about food or you think about your weight constantly? Find yourself trying one diet after another without any success? Now, these are just a few of the questions that could signal a problem with a food addiction. You might weigh over 300 pounds or under 100 pounds. You might even have a normal weight. What they have in common is their obsession with food, and this is individuals who are struggling right now. Some are now turning to a group called Food Addicts in Recovery Anonymous, an international organization that's based on the 12-step program and shares support among its members. Joining us live right now to talk about food addiction and what you can do about it, Dr. Vera Tarman, a medical doctor who deals with addictions through the Renaissance Alcohol and Drug Treatment Center. We're also going to be joined on the phone by Erin, a member of Food Addicts in Recovery Anonymous. Thank you very much for being here. Really appreciate it. Sure. You're taking a bit of a different approach now when it comes to addictions, and in this case, what we're talking about today, food addictions. You're now labeling this as possibly a disease. How did you come to that conclusion, you and other medical experts?
Well, let me give you the definition of food addiction, first of all. I want to say that it's terminology that we use to define behavior whereby a person uses particular foods, not all foods, just particular foods, namely sugars, starches, fats, as if it were a drug of abuse. And traditionally, the way that aberrant food or aberrant eating conditions have been viewed medically has been by looking at it from a pathological point of view, bulimia, binge eating disorder, or compulsive overeating, which has not taken the viewpoint that it's an addiction, that it's a disease of addiction itself. And from a medical point of view, that's a new way of thinking about it.
Does it make it easier for those who are struggling with this disease to access help, to feel comfortable about getting help, to talk to family members about the problem that they have, because it has a different label now?
Well, frankly, I would say it at this point in time doesn't make it easier in the professional setting, because in the professional medical setting it's still viewed as a different type of pathology, namely an eating disorder which has nothing to do with addiction. But where it is helpful is it does allow people to access the 12-step programs, of which there are many in the community, now even some specifically to eating disorders. And it addresses a different focus, a different dynamic, and hopefully a more successful one than the others have.
Are there certain types of personalities that are more vulnerable to addictions, to whether it's a food, a dependency on food or drugs or sex or any kind of thing that can become compulsive? Is there a type of personality or types of personalities that you see more often?
Well, the answer would be yes and no to that. Yes, you could say that there are types of personalities, i.e. a person who's more narcissistic or more antisocial or more what we call a borderline personality, but that would be also incorrect, because one of the things about addiction is it's very democratic. It affects all people, whether they're extremely sedate and well behaved, or as it were, and don't have a particular personality type, all the way to the ones who do. So the answer is a bit of a yes and a no.
Why is a food addiction considered dangerous?
Well, any kind of aberrant eating is considered dangerous, because if a person indulges too much in particular types of food, it can cause negative consequences. I.e., when we talk about food addiction, we're talking about particular types of foods: sugars, starches, fats. And when a person is addicted to that, most likely they're eating more than it would be considered normal. And I want to just say a caveat there: eating sugar of any sort is not really normal. The body is not really equipped to deal with sugar in the refined packaging that it is today. It can handle apples, but it can't handle chocolate bars.
So is this a physical thing, or is it a mental, emotional thing?
Well, it's a physical thing which becomes a mental, emotional thing, because what happens is when a person eats these particular foods, they overwhelm what we have in our sort of non-conscious part of our brain, the reward center. It overwhelms it in the same way that drugs and alcohol do, so that where a person might be able to say, no, I've had 2 apples, I'm fine now, the reward principle overtaxes, and so that they might, after 2 chocolate bars, say, I still want more, because the addictive component has come in. So you get the physical consequences of diabetes, heart disease, obesity, and you get the mental consequences where the person can't say no. It's a feature of addiction.
And is recovery something that you see more often than not? I know that when you're talking about addictions, you don't use the word cured. You live as a recovered addict, whether it's food or drugs or any of the things that we have mentioned.
That's right.
And is it achievable when it's a food addiction? You know, you need food to sustain life. So how do you abstain from eating food, or is it the certain types of food?
It's the certain types of food. That's a very good question. You can't stop eating, but you can stop eating particular foods. You can stop eating sugars. You can stop eating white starches. You can stop eating overt fats. You asked the question, can you actually be cured? No, you can't. The vantage point from an addiction framework is you are at best in remission, and it is a constant daily I mean, people talk about it in 12-step programs as you have to be in a spiritually fit condition. In other words, constantly vigilant to not allow yourself to be in a situation where this overwhelming urge can take over.
We're going to be speaking very shortly with Aaron on the phone. He wishes to remain, you know, private, anonymous, if you will. Why is that?
Well, he's speaking from a 12-step point of view, and the whole concept behind that is that the people are anonymous so that they feel free because of the stigma attached. They feel free to declare themselves and seek out help. It's one of the main reasons why alcoholism is as rampant as it is, and drug addiction and now food addiction. And in a sense, food addiction has more stigma attached to it, because while you can get away with having 6 or 7 beer in a bar on a Friday night, you can't really get away with 6 or 7 pieces of cheesecake. After the 4th or 5th, your friend is going to say, aren't you having a bit of a problem? And people end up being more private about it. So it has more of a stigma, and having this anonymity piece attached to it will invite people to come out and seek out help. We're
going to take a short break, and then we will resume this discussion and bring Aaron in, and of course people watching and listening right now. Remember, Talk TV on Health is interactive. We want to hear from you, so please call us with your questions, your comments, and please your personal stories. Here are the numbers to call within the GTA: 416-872-CP24, that's 2724. Toll free, 1-888-863-CP24. If you're on the internet, please send your email to talktv@cp24.com. We'll be right back after this short break. We'll be taking your calls about food addiction when we come back, so please give us a ring. Welcome back to the Health Edition of Talk TV on CP24 and Radio 1050. I'm Ann Romer. We're talking about food addictions with Dr. Vera Tarman from the Renaissance Center in Toronto. And we're going now on the phone to speak with Aaron with Food Addicts in Recovery Anonymous. Aaron, thank you very much for being with us live.
Hi.
Hi. Tell me about your life before you tried to get some help.
Sure, absolutely. I grew up in Toronto, and at a very young age, I started, dealing with issues around food. And I think I attended my first diet-related meeting when I was 10 or 11 years old. And, I was around 50 pounds overweight when I was